Veterans are twice as likely as non-veterans to die from accidental overdoses involving prescription opioids. In an effort to lower opioid intake, some veterans are turning to hemp products like CBD oil to treat chronic pain and PTSD. Nancy Cordes spoke to a group of veterans lobbying Congress to push the Department of Veterans Affairs to study hemp and its potential benefits. Nancy, good morning.
Good morning. Hemp products like this CBD oil tend to get lumped in with marijuana because they're both derived from the cannabis plant. But this won't get you high, and unlike some opioids, it won't get you hooked, leading some veterans to say they want more research and more access.
I would like to make very, very, very clear, this is not marijuana.
These are not your typical lobbyists.
The side effect was to be more angry, more depressed, and also seizures.
They're veterans whose lives were nearly ruined, first by their injuries, then by their meds.
I was at a higher than likely rate of committing suicide from pain. And
Navy veteran Veronica Wayne took opioids for 17 years after an airplane maintenance hatch hit her head.
I basically became a walking zombie.
She tried medical marijuana, but still felt impaired. That's when she heard about hemp.
It's going to still kill all the pain symptoms and give you the relief that you need, but you're not going to feel high.
Now she uses CBD, an oil derived from hemp.
But you can't get it from the VA.
You can't get it from the VA. It's not legal.
Like marijuana, hemp is derived from the cannabis plant, but it does not contain THC, the chemical that makes you high. Still, both hemp and marijuana are classified as Schedule I controlled substances, restricting the VA and other federally funded entities from conducting research. The American Legion is leading the push to change that.
Anything that makes a veteran feel better, especially something that's non-toxic, is something we're going to support.
Currently, hemp products are marketed as unregulated supplements, which makes many doctors reluctant to recommend them. Wayne Jonas is the former director of the NIH Office of Alternative Medicine.
But we're not exactly sure how to use them, what the right dose is, how they interact.
There are lawmakers on both sides pushing to change the law.
I'm actually cautiously optimistic if we get something on the floor that it will pass.
Until then, Army Reservist Dale Ryder says many of his buddies are wary of the product that he says helps his back pain.
For them, they're all worried that because it's so closely related to marijuana that it could pop up on a drug test randomly.
The cause has a powerful ally in Senate Majority Leader Mitch McConnell, who hails from Kentucky, where hemp is seen as a potential cash crop. Last month, he introduced the Hemp Farm Act of 2018, which would legalize hemp as an agricultural commodity.
Nancy, thanks. All politics being local.